Ready to get started? Am I on, Ryan?
Yes.
Yep.
Okay, good afternoon, everyone. My name is Russ Duke, and I'm the Director of Central District Health. Central District Health is a 4-county local health department covering Ada, Boise, Elmore, and Valley counties. Central District Health is not a state agency. We are a local governmental agency that is overseen by a local board of health. Board members are appointed by county commissioners. And I have with me today the 3 Ada County board members, Dr. Ted Epperly, Dr. Jane Young, and Ada County Commissioner Diana Lasciando. They will be speaking to you in a few minutes. And also joining me are Brandon Atkins from Central District Health and Ada County Sheriff Steve Bartlett. They'll be available to answer any questions. As you probably have seen in the news recently, we are seeing a significant increase in cases of COVID-19 in Ada County. Our cases had remained relatively low since the end of April. However, starting on Monday, June 15th, we saw a noticeable increase in cases. This trend upward has continued throughout the week. Initially, many of the cases were associated with bars and nightclubs, but the infection has reached further out into our communities and has risen to the point of great concern. This prompted our Board of Health to meet, where a decision was made to move Ada County into stage 3 and implement the stage 3 restrictions by way of a public health order. Bars were allowed to open in stage 3 of the governor's orders, but due to the clusters of cases we are seeing associated with bars, they will be required to be closed as of the date of this order. I will be signing the public health order this afternoon, and it will be posted on our website later today. The order will be effective at 12:01 a.m. on Wednesday, June 24th. And it will remain in effect until we see a consistent and sustained decline in cases. To review the main points of this order, gatherings, both public and private, of greater than 50 are not allowed. The 14-day self-quarantine for people entering Idaho from another country or from an area outside of Idaho with substantial community spread. For employers, if you have employees who are considered vulnerable individuals, you should have them self-quarantine, and special accommodations for these employees should be made in the workplace if they are unable to work from home. Visits to senior living facilities and congregate facilities such as jails and correctional facilities are prohibited. Bars and nightclubs will be closed, and large venues such as big sporting events and concerts will not be allowed. Now, assuming our technology is working correctly, I'm going to have you hear from our Ada County Board of Health members, and we're going to start with Dr. Ted Epperly, followed by Dr. Jane Young, and then Commissioner Diana Lasciando. So I'll turn this over to Ted.
Well, good afternoon, everyone. I hope you can hear me okay. I'm getting just a little reverb on my end. Is it okay on yours? Okay.
It's good, Ted.
Okay, thank you. Again, I'm a family doctor in town here. Been in our community, born and raised in Idaho, know our community extremely well. What we're seeing happening in our community now is of great concern to me as a physician. We've had a major increase in cases, as Russ has just shared with you. In the last several weeks, we've seen the cases in Ada County explode from 25 cases 2 weeks ago to 57 cases the week before last, and 303 in this last week. That's a 500% increase in cases in Ada County. Now that, in perspective, is the highest number we've seen of coronavirus infections since the inception of the COVID-19 pandemic. It's higher in actual numbers of true cases since our highest week back at the end of March and early April. We've seen ER visits increase, almost doubling. And in our clinics, and we have 9 of them that are throughout the Treasure Valley, we've seen almost a 2-fold increase in the number of positive cases. Primary Health, which is one of the other large clinics that does testing in our area, has noticed positivity rates of 15 to 22%. This is markedly increased from their baseline of about 5% in the last 10 days. And in fact, they've had 24 cases just reported this morning from this weekend's caseload that haven't even made it onto our graphs yet. That puts us really in a positivity rate that approaches that of Blaine County, which you all know was the epicenter and the highest county in the entire United States at one point in the outbreak. That's why this is a problem. And in fact, I just want to amplify for just a minute. This is more than just a bars and nightclubs issue. This is a community-wide active spread. And that's why these steps are being taken. We certainly, as a Board of Health, don't do that lightly. We understand totally the impact on the economy and people's lives. But this is a serious health issue that we're facing now in Ada County and in our region. So we're going to act appropriately to make sure that we do what is necessary to make sure people are kept as safe as possible. Now, please understand, there are just a couple more points I want to make. That it takes anywhere from 2 to 14 days to become positive once you are infected and exposed. So what we're seeing today really happened about 7 to 10 days ago. And what happened this last weekend in terms of activities in Boise, Father's Day, all the activities that we all participated in will not appear until 7 to 10 days from now. So what we're facing already with data that's now a couple weeks old is really a major outbreak, let alone what it'll be in 2 weeks from now. In fact, we need to put right now the emergency rooms and the hospitals on alert for increased caseloads that will come through the emergency room, into our hospitals, and potentially into our ICUs. That's the magnitude of the problem. The problem with COVID-19, because it's extremely infectious, is that you can get behind the 8 ball on this really fast. And what the data is saying right now at this point is we're behind the 8 ball. And that's why the Public Board of Health has taken the actions that we are. One last point that I'll make with you all. The people in our community need to be part of the solution. We must take this seriously. It's a serious problem. We need to double down our efforts, all of us, on infection control, on social distancing, on good hand washing, on paying attention to this. If we don't, then not only do we put people at risk and lives at risk, but also we need to do this to protect our businesses and protect people's jobs in our communities. If we don't, then people will be at risk, jobs will be at risk, businesses will be at risk. And with that, I'll stop at this time. Look forward to your questions as we discuss this further. Thank you.
Okay, now we'll hear from Dr. Young if she's able to connect. Dr. Young. Okay, it looks like She's not going to be able to speak. So we'll go to our third Ada County Board of Health member, Commissioner Diana Lasciando.
Thanks, Russ. And thank you, Dr. Epperly. Can you hear me?
We can hear you fine.
Great. Well, I just want to thank you, Russ, especially for your tireless leadership during this challenging year. As a new Board of Health member, I'm really grateful to learn from all the health expertise that we have on the Board of Health, and especially with your tremendous staff. We are very lucky to have such a top-notch staff trained at some of the best institutions around the country. As an elected official, I feel very confident and comfortable with the health expertise that we have leading us. And as a Board of Health member, obviously our primary concern is of the public health and safety of our community, coupled with the economic well-being of our citizens. These are difficult decisions, and this decision was not taken lightly. We know, however, that our communities are all tied together by more than just a city line, and people are interacting across cities in both work and play. And this is the right thing to do in the right moment for our county. I want to share a little bit for those who don't know, because Central District Health is something that is new to a number of people. At Ada County, we are one of 4 counties that are partners in Central District Health. We financially help to fund the Board of Health, and I am your commissioner sitting on that board. And again, we are very confident and grateful in the expertise that we have from this wonderful department. I've been able to communicate with all of the mayors in Ada County to share with them, obviously, both what we're seeing in terms of the health data, as well as what the repercussions would be going forward. And I just want to continue to amplify what Dr. Epperly said. We recognize this is hard. We recognize that people are feeling COVID-19 fatigue, but unfortunately the virus is not fatigued, and it is still here in our community, and it has accelerated rapidly. So we need people to adhere to what Central District Health is setting out to take care of themselves and their neighbors. And with that, I will send it back over to you, Russ.
Thank you, Diana, and thanks, Dr. Epperly.